Okay, ladies and gentlemen, we're going to be talking about the brain part 2. Now, we've talked about protection, and we've talked about the cerebral hemisphere a lot. We'll be talking about the limbic system in the cerebral hemisphere today, along with the diencephalon, the cerebellum, and what the brainstem has. Another image that you will need to be able to label with all of its parts. The limbic system, known as the paleomammalian brain, or the primitive brain. It regulates survival instincts, such as fear and anger, sex, pain and pleasure, memory and hunger. Now, it has 5 different sections to it. The amygdala is the emotional response, hormone secretion, and memory. It determines where the memories are stored and which ones are stored and where they're stored. The cingulate gyrus is for sensory inputs concerning emotions, and it regulates aggressive behavior. The fornix connects the hippocampus with the hypothalamus. Now, what is the hippocampus? It is a tiny nub that acts as a memory indicator. It sends out memories to the appropriate spots in the cerebral hemisphere for long-term storage and retrieval. The hypothalamus is a pearl-like structure that does many things. It wakes you up. It gets adrenaline flowing. It helps with the emotional center, making you feel exhilarated, angry, or upset, or unhappy. Now, talking about the cerebellum, this smaller portion here of the brain, it is known as the little brain. It receives impulses from muscles and joint receptors and eyes. It helps coordinate movement, and specifically complex voluntary muscular movements. It helps with posture and balance, and alcohol can inhibit the cerebellum, therefore throwing your balance off and coordination. Again, we see our cerebral hemisphere, we see our diencephalon, we see our cerebellum, we have the midbrain, we have the pons, we have the medulla oblongata, and then we end up with our spinal cord. Now, yes, you will need to be able to label all of these pictures on your test. Let's talk about the diencephalon, the center portion. It's got 4 main things. It's got the thalamus, it's here. It's the relay station for nerve impulses for the sensory cortex. It does recognition of impulses, whether things are good or bad. Then we have the hypothalamus. Hypo means below, so below the thalamus here. And it's the overall autonomic nervous system. It regulates the hormones, it regulates the metabolism, the body temperature, the water balance, basically the limbic system for emotions, and it regulates the pituitary gland. Well, the pituitary gland is right here, and it's also part of the diencephalon, and it produces hormones, all types of hormones. Then we have the epithalamus, which is right above the thalamus, right here, epithalamus. And it has the penile body, it's going to be over this guy, and then it also has the choroid plexus, which has the formation of the cerebral spinal fluid. Now, the brain stem goes here, has 3 main portions. It has the midbrain, which is the nervous pathway from the cerebral hemispheres, from the auditory and visual centers. We have the pons, which is right here, which is involved in breathing. The medulla oblongata, which controls heart rate, blood pressure, breathing, and swallowing. And then we have our spinal cord. So again, with our brainstem, we have the 4 main pieces. The midbrain, we have the pons, the medulla oblongata, and then we go to our spinal cord. Now, traumatic brain injuries. A concussion is one of the most common ones we have, especially if you're an athlete. That is due to blunt force trauma and the brain contacting with the skull. Now, typically, we have a front to back concussion, where we have the brain hitting the frontal lobe and then the occipital lobe. But sometimes you can get hit from the side and cause damage to your temporal lobe. Now, this is a brain injury that is not permanent. It can recover. Contusions, on the other hand, is when we have nervous system that is actually damaged and it does not regenerate. We have the cerebral edema, which is swelling from an inflammatory response. It can compress the brain and kill the tissue. Injuries to speech areas. There's going to be mostly in the frontal lobe. We have aphasia, the inability to speak. Agraphia, the inability to write. Word deafness, you are unable to hear the spoken word, but you can still read it and understand. Word blindness, you can hear it, you can understand it, but you can't read it. Cerebrovascular accidents tend to damage the actual brain itself, such as a stroke. In a stroke, we have some of the brain tissue dies due to lack of oxygen. This loss of function may result in death, but it's typically seen with loss of a function. Now, this function can be regained by adding new nervous connections around the dead portion of the brain, but the brain portion is dead and it cannot be revived. The signs of a stroke: you want to act fast. You can tell that somebody has had a stroke if their face is uneven, if they can't keep their arms out straight without one drooping, if speech is impaired. And then for the T, if you see any of these, make sure that you call 911 quickly and in a timely manner. Alzheimer's disease is a progressive degenerative brain disease, so the brain is degenerating, especially the hippocampus, talking about the memory, most seen in elderly but can begin in middle age, and it leads to memory loss, irritability, confusion, and ultimately hallucinations and potentially death. Our ventricles that carry our cerebral spinal fluid are enlarging, and our hippocampus is decreasing. We also see structural damage, such as abnormal protein deposits in the brain and twisted fibers within the neurons. And that's all I've got for you today. Bye.